Now I would like to turn things over to Terry Hill, Senior Advisor for Rural Health Leadership and Policy at the Center, to introduce today's speaker and to kick us off. Terry?
Thank you very much, Keely, and good morning, everyone. The topic of the day is really pretty close to my heart. It's talking about staff, keeping our staff safe and well and resilient in a time of crisis. Just a little bit of my background. I'm the founder of the center. I've been working with rural hospitals for more than 30 years now. And in the course of what the National Rural Health Resource Center does, we not only work with state programs, and we do a lot of work just basically gathering information and sharing it nationwide, et cetera. But we do a lot of work on the ground, working specifically with rural hospitals across the United States. We've worked with hospitals in Nebraska, but currently we have a huge project working in the Mississippi Delta, just basically helping on financial and performance improvement and actually responding to the pandemic, just helping those hospitals. In the course of conversations with them recently, we're basically identified a major issue that is coming up now, and that is the ability of staff to basically kind of hang in there as we're increasingly facing folks with the COVID virus, as our communities are struggling with issues like getting folks to wear masks, et cetera. So in the course of planning these series of events, we felt it was incredibly important to really focus in on how do we keep our staff, how do we keep them healthy and resilient, et cetera. So this is the third in a series of webinars that have been funded by the Nebraska Office of Rural Health. The funding comes from the Federal Office of Rural Health Policy, and kind of in that regard, we've selected a speaker today that is kind of our go-to person on human resources. Lee Elliott is a friend and probably the best read individual I've ever met on this particular topic. He's a nationally known expert on human relations, staff resiliency, staff culture, and conflict management. Lee is one of those very, very rare people who actually enjoys going into conflict situations and kind of working it through and helping to produce the kind of results that have become identified with him. He was formerly the HR director for the hospital in Grand Island, Nebraska, so he comes from that Nebraska background. He's worked with rural hospitals across the Midwest. He has taught in colleges and universities, and he's become one of our HR advisors to our national center. Kind of with that, I'm going to throw things over to Lee, and unfortunately his camera isn't working today, but the audio is just fine, and we will have a question and answer period at the end. I would also, though, encourage you, if you have questions, you're certainly welcome to ask them or put them in the chat box, and Keely will be looking for those questions and be able to translate them when Lee is done. So with that, Lee, I'm going to turn things over to you.
Thank you, Terry and Keely. So nice to see you guys. Unfortunately, you can't see me. I guess, what was the comedian's line? He had a face made for radio. Maybe that's what my technology is telling me. That's what I've got. Who knows? We're going to be talking about a subject today that I have been dealing with for, oh my goodness, now 20 years. How do you get enough staff in the world of healthcare? If you know the research on this, if you drop from 4 RNs per patient, 4 patients per RN, now wouldn't it be a delight to have 4 RNs per patient? 4 patients per RN to 5, mortality goes up 7% on a med surg floor. If it hit 8 to 1, It's a 30% increase in mortality, and that's well researched. That's validated. That's our reality. So it's important that staffing ratios don't put patients at risk. I will tell you how I got into this was in the year 2000. One of the departments I was responsible for at St. Francis in Grand Island was HR, and we were in a mess. So this becomes the mother of invention, if you would. It was a necessity. I had to come up with something. Intriguingly, I put a subtitle on this, is anyone else looking forward to 2021? And I saw a cartoon not long after I put that up that was just appropriate. This gentleman was looking kind of perplexed, and he said, "Boy, where's your mom when she needs you?" She said, "You know what? I think if you do that again, I'm going to smack you in the next year. I'm going to try and figure out how she was able to do that." So I think we'd all like to be next year, wouldn't you? Where we're at right now is quite extraordinary. You folks are in the thick of an organizational trauma, and you're not unique. I've never seen organizational traumas on this scale. One of the companies I'm on the board of laid off a third of their employees. They never laid off anybody, ever. And they laid off a third of their employees. They're aerospace. And frankly, they just don't have options. When I start talking about trauma within an organization or organizational trauma, you're living it. Now, here's a definition I put together on that. One or more large-scale stressors that adversely impact the emotional state and functioning of a substantive number of individuals within an organization. Examples: a layoff. Here's a hint for you, Nebraska hospitals. Mercy System in Iowa said they're laying people off. So layoffs do it. I hear Orlando, Florida. My goodness. They've had a 1,200% increase in COVID cases in Florida, and the Orlando hospital system is laying off. The finances of these times that you folks are going through, nothing I've ever seen before. You get a mandate that you can't even run part of your hospital, and a promise from the government that in fact you will be paid something to keep you afloat. And I'm sure you spent some long nights thinking, oh my God, I hope it's enough to truly keep us afloat. And now you're mandated to open right back up again. Operationally, that's a nightmare. The bad news is financially, it's also a nightmare. That's tough. Oh, and by the way, we got this really incredible, awful disease going around that leads to suffering and brutal deaths. That's trauma. You got it. Having said that, let's look at some symptoms. You're going to note that you're having organizational trauma if you're seeing increases in conflict. And you know what? You're going to see dumb conflict. Good quality conflict is there's a clear definition of the problem. There is, in fact, high quality resolution to that problem such that it's resolved and resolved long-term effectively and with a minimum of hard feelings. When you get poor quality conflict or dumb conflict, you don't get that. I'll tell you, I spent quite a bit of time over the summer working with bullying, and 2/3 of the people who are bullying are managers. You get a bunker mentality. People kind of lose focus on what's the primary function of the place. They really start shifting to self-preservation. And hopefully the place stays open, but I want to be sure I don't lose my job. No risk. People are not going to take a risk. In a situation where there's really high levels of stress, they don't take risks, which means there is no creativity. Now, in the world of business, Terry said I teach college, had the good fortune to do that quite a bit. I teach business. And in my classes, I teach that 4 out of 100 companies make it 10 years or longer. The way the 4 survive is having sustainable competitive advantage. The reality in Nebraska, you have 5.5% unemployment. That's unheard of. Nationally, it's 13.3%, and places like Nevada are shooting through the roof. You don't have a lot of unemployment. You have a new hospital opening in Grand Island in a few months. Few weeks, maybe. I don't know, maybe they've already opened. I haven't heard. But there's going to be a real strain on the patient care staff in your organization. It's going to require some creativity to get them to, the people to come to work for you and to stay to work for you and not lose them to other bigger hospitals. It's going to take some real work and some true innovation. Organizational trauma and the stress that's going on will minimize that. Because of this, you get poor decisions. You get people being defensive when they talk to each other. They don't just talk through issues very effectively. The good ones leave. And then the ones that are left behind are more anxious. You can actually get created what's called a loser syndrome. People get to a point that they just don't feel good about work. A lot of stress. Maybe you'll find the organization just saying, you know what, we're just not going to talk about it. It's going to pass. Let's just leave it alone. When you do that, you get enormous numbers of rumors. Rumors are created when two conditions are present. One is, in fact, when an individual is anxious and there's not enough information. My favorite rumor was after Pearl Harbor, the people on the East Coast were saying that the Japanese had invaded California and were making significant inroads into that state already. They just didn't know. They were scared. And in the absence of information, they begin to fill in the gaps, the rumors. We get a significant increase in displays of distressing emotion. I'm hearing from lots of hospitals, including some in Nebraska, and it tends to be the executive team. First time I've seen this. The executive team and lab are melting down. One place I talked to said every single member of their executive team in the prior month had melted down. Just too much stress. When you get an environment like that, recruiting is really tough. Unless the applicants are desperate. Did I mention you guys have 5.5% unemployment? You don't have desperate people out there. So don't count on it. You may be able to get housekeeping, laundry, and positions like that easier. But med techs, nursing, PTs, pharmacists, no, that's not going to be that way. So that's the symptoms, if you would. So what do you do about it? The worst thing you can do is just say, okay, this will pass. Let's just keep on doing what we're doing. That will turn into a disaster for you. That's not going to work. The best solution comes actually out of the Ross School of Business at University of Wisconsin. Kim Cameron is the associate dean there. I believe he just recently retired. He's an amazing fellow, and two of his colleagues and he got together and wrote this paper. I'm going to encourage you to get this paper, read it a couple times. Now, it uses the word virtuousness. Important thing to note, this is not the philosophical notion of virtuousness. It's not the theological notion of virtuousness. It's the business notion of virtuousness. When, according to these folks, an organization becomes increasingly virtuous, you don't have the symptoms of organizational trauma. They don't show up. Now, here it was in St. Francis. The year's 2000. I can't get enough staff. I don't get enough staff, patients die. Doctors aren't going to go along with that. Hospital's not going to go along with that. Ethically, it's not appropriate. Legally, it's not appropriate. So we had to put in place a system that said if we ever hit to a point that we're not safe, patients got to go someplace else. You folks know if we do that too much, we lose our doctors. That's really spooky. So we went to work and we decided what we would do based on feedback from the employees. They're the ones who guided us through this. I'd read a bunch, as Terry said, I like to read. I talked to all sorts of people, some really incredible people, all over the place. And we really didn't have answers. We were doing everything pretty much that everybody suggested that we thought would work at our place. So we went to the employees and said, guys, tell us what? How do we get out of this mess? And some of them said, well, Elliot, you know, you're a mediator. Why don't you help us with conflict? So I did. We went to work on mediation. We, in fact, found that conflict was going away. Not actually true. That's not true. The quality of conflict was going up. The frequency of conflict was going up. The frequency of dumb conflict, destructive conflict, was dramatically going down. The supervisors reported about a 98% success rate, and they came to me and said, you're spending way too much time mediating conflicts. Why don't you teach us? So I said, sure. So I designed a training program on how do you have a good conflict. Called it high quality conflict. From there, it became apparent that there's a certain percentage of people have such intense hard feelings because they've had multiple conflict episodes that you better try something different. The standard conflict resolution techniques don't work because they first have to get rid of their grudges. Well, I put together a training program based on some good research I found actually being done in Northern Ireland on how do you get Catholics and Protestants to forgive the person that murdered their family member. The professor was out of Stanford, a fellow by the name of Fred Luskins. I liked his work, put together a training program of forgiveness, and nobody showed up. So a friend of mine said, hey, call it grudge busting. So I did. And son of a gun, we got a full house. And that became my most famous, most desired training program, because people, when you get done with forgiveness, the state you're left in is peace. And we had never taught people how to forgive before. So we tried it and it worked. So at that point in time, the stress level of the organization comes down precipitously. We're just not having bad fights. I talked to a client some months ago and said, how's your fights? They said, well, we really don't have conflict much anymore. What we do is we identify problems and we fix them. That's it. You know, if we do have a conflict that's involving hard feelings of some sort, we all work on it, we get through it, and we get done with it without residual. From there, we said, hey, tell you what, we can get it to a point that people are at peace. What say we train people on how do you have a life that you can enjoy? Now, wouldn't that be an innovation in the market that would bring people to us? And it worked. Looked up Martin Seligman's work at the University of Pennsylvania and others, and created a training program on how to be happy. The research since '99 has exploded. It's good. And you betcha we can teach people how to be happy, and it's not terribly hard to do. At the core of that is trust. How do you get people to have friends? Well, it's trust. So we teach trust. There's two pieces that you got to also have to really enjoy life, and we're going to talk about both of them in just a moment. One's resilience, the other one's stress. Put those together, you've got all pieces of how do you enjoy your life. At that point in time, 8 years had passed, 9 years had passed, that is. Job vacancy at our place was down to 2%. We were saving $1 million a year. Number of applicants, not per opening, but total number of applicants tripled. We were finding ourselves in a situation where we weren't having any trouble recruiting. In fact, people were coming our way. Things were just working well. And we didn't really need to recruit. Now, one could say, well, that happened because of the Great Recession, but most of a reduction in job vacancy happened before 2008, during very strong economic times. After 2008, we didn't see a lot more reduction in job vacancy. So, having said that, I had the opportunity to take it to third level. We did some additional training on additional topics, but I want to move on. I want to talk about resilience. If in fact you're going to have a workforce that's going to work effectively for you, you better have a resilient workforce. And the research on this is pretty clear. For those who like to read, I encourage you to read Kerry Cooper, guy out of Canada. He does some really good work. What his research shows is resilience is determined by the ratio of positive to negative emotions we experience throughout the day. The higher that ratio, the more positive emotion we have relative to negative, the more resilient we're going to be. Now get this. If people do not have adequate resilience, they have no positive psychological functioning. That's a real problem, a real problem. We noted that with a respiratory therapist I worked with one time. Lovely lady, had kind of a challenging life. She got her degree, came to work for us. The very first code blue we called, she ran the other way. We had to work with her to get her to a point that when the code's called, she had to run to the code, not away from the code. But she had virtually no resilience. She just couldn't handle it. Too much stress for her. Here's the cool thing. Resilience is totally due to how you think. That means you do not have to turn to anybody else to modify your resilience. As you teach your people how to think differently, as you change your own thinking, then things happen. The reason that's true is all emotions come from how we think. If you ever ponder how it is that you and I are in the same situation doesn't bother you at all, rips me up, it's awful, oh my God. How can that be? It's the same situation. Well, it is how we're thinking about it. You're thinking about it differently than I am. So the fundamental effort required, if in fact we are to get to a point that we're going to have people be resilient is you have to change their thinking. Now, research on this has won a Nobel Prize, so this is pretty heavyweight research. It's highly reliable in my mind. We have two different paths of thinking. One is conscious thought. That's where you're at right now. When somebody says, who are you? Well, you describe from the conscious thought level. But we do an enormous number of things at the automatic thought level. Ever leave work and drive home and not remember leaving home? Or remember leaving work? Ever get in your car and drive X miles and be pulling into your garage and not having a clue where you've been? You just somehow showed up there. We can do that. A 4,000-pound vehicle driving X number of miles an hour for a certain amount of time, we don't break any traffic laws. We don't run over anybody. We don't drive through somebody's garden. We do everything right and we pull into our garage. How do we do that? It is the automatic thought function. Now, sometimes these automatic thoughts get us in trouble. Now, let me tell you the big one, a couple of big ones. There are several, but about 11, 12 of them, I think. I laughingly call it the shoulds. When we say, you should behave the way I say, you must act like I insist you act, we're saying we can control that person. And that is the source of all conflict. It's not their behavior, it's how we think about their behavior that gets us upset. Can someone make you mad? The answer is no. Not doable. What we can do is to teach you to think of the situation differently so that you say, I wish they would do it that way. I would prefer they do it that way. As a manager, you may say, you know what, if they don't do it that way, then they can't work here. But as soon as you start escalating into the shoulds, and it happens automatically, you don't even notice it. You just feel upset. You just feel distressed. Anytime you have distress like that, look behind it. There's going to be a thought that says, you must behave the way I say. You should do that. And the example I typically use is if somebody's driving down the road and they behave in a manner that you don't like, and we get really upset, do they change their behavior? Do they, in fact, change the way they're driving? Do they stop and get out and give apologies? None of that happens typically. In fact, they typically don't even know that we're upset. They get upset, rephrase that, they drive poorly, we get upset, we have physiological changes associated with the fight or flight syndrome, the stress response, that if we do it enough, we will die younger. 80%. And I've checked this with doctors at critical access hospitals in Nebraska. 80% of the patients going to see the clinics are in fact there because of stress-related conditions. This is a big one. When we start insisting that the world functions like we say it must, we start getting upset. We get stressed. And here's another one. It's just awful. It's so terrible. It's called catastrophizing or awfulizing. And here's something that's fundamentally almost unfair. Research has shown that when we're kind of a resting state and we really don't have anything we're thinking about, the mind tends to drift into, ain't it awful? The more we do that, the more hopeless we become, the less effective we become, and the less we enjoy our lives. That's the stuff I'm talking about. When I start talking about automatic thoughts, I'm talking about shoulds, I'm talking about awfulizing. There's others, but anytime we have an automatic thought that goes a little wacky, the consequence is a distressing emotion. We can teach people quite effectively and quite easily to think differently and shrink the amount of distressing emotion. Remember, I'll rephrase that. Resilience is in fact a ratio of positive to negative emotion. If we can increase positive emotion by increasing happiness and trust and having good relationships and making the world of work kind of a decent place to be, that's cool. That's raising the numerator. If we change the way we think at the automatic level, we shrink the negative emotions. We build stronger and stronger employees. And when you get that, you're in a different work environment. They handle things so much better. It is important that everybody out there learn how to fix automatic thoughts if you wish to increase resilience of your employees. And if you're going to survive effectively in organizational trauma, pretty much essential that you do that. Really aren't a whole lot of options here. Okay. Now let's talk the big one. $300 billion a year are spent on, or is spent on stress-related conditions. I first read that, and then I read another paper said, oh, it couldn't possibly be that much. I thought, well, I'm going to dig around on the internet to see what evidence is out there that it is or is not correct. I didn't have any trouble finding $300 billion worth of costs. Think of it, 80% of the people going into clinics are there for stress-related conditions. They got health issues, cardiac problems, they got respiratory problems, we have depression. Oh my goodness. And now the ACEs studies, the Adverse Childhood Experiences studies coming out of CDC have shown that if we have major stressors early on in life, they can produce poor health 50 years later. And sometimes for conditions that I just did not see attached to stress. It's a fascinating read. If you've not done that, get on the CDC and check out ACEs, Adverse Childhood Experiences, because kids are hurt by stress. Oh, now here's another thing you're not going to like. We take it from work to home. Research we did in Nebraska, we tend to take about 4 times as much stuff, emotional baggage, from work to home as we do the other way around. And if you think of how much stuff comes into the world of work from home, then multiply by 4. That's how much is going the other way. It becomes important that the world of work, therefore, be really, truly an effective place to be and you know, not tied up in massive stress, or you're going to mess up home lives. And then that's going to make things at work harder. It just goes on. If you are to reduce this stress, well, one thing to do is, you know, improve conflicts. If you get to a point that people, when they get into having a distressing thought, they're upset. If they go, wait a minute, I want to pull this apart. I want to say, what am I thinking? What is the emotion I'm having? And then what is the automatic thought that's precipitating that emotion? Do that. Okay, now I have an understanding why I don't feel good about this. Now I want to take a look at that problem. And if you talk to the quality people, they got amazing techniques for clearly identifying the problem. I'm sitting here talking to you in Sioux City, Iowa. The wizard of quality was born here, Edward Deming. Get to know quality in the realm of how do you clearly identify what a problem is. Then solve that problem. If you don't take step 1 right, everything else is a waste of time. It's not going to work for you. The second step is to say, you know, what, now that we have the problem, what are ways we can come up with techniques, with approaches to resolve that problem most effectively? And again, I'm going to refer you back to the quality people. It's kind of fun because when I talk to the conflict people, they've not considered quality technique. And I said, you're missing a gold mine. What Deming has said and what all these quality folks are now saying are wonderful tools and techniques to use in conflict that help you get to a point that you resolve the problem effectively long-term and with a minimum of hard feelings. If you do not come away from a conflict with a minimum of hard feelings, and they leach over into the subsequent conflicts. You'll know that when you walk in the room with people and you have varying degrees of positive or negative reactions to everybody in the room. Those positive and negative reactions become part of the interpersonal underworld of your organization. And they change the way you work. They change how you experience your life. When you go home at night and you think of a person, if you're holding some, you know, distressing emotions associated with that person, if you got a grudge because of the way they behaved in some context, that's not a good deal. Something to work on. If we get to a point that you solve problems, you have minimum grudges, then stress goes down like a rock. Now, having said that, increasing happiness. Really, have you ever seen somebody really happy, joyful, enjoying life? Who's stressed out? No, not really doable. As a consequence, you can build happiness by doing little things like increasing gratitude. 3 to 5 things. Count your blessings once a week. You don't have to do it more often than that. If you want to, you can. But there's a book out there called Thanks by Robert Emmons. The fellow is heading up $8 million of research on gratitude. And oh my goodness, it's amazing what they're finding. Just the little simple act of stopping and saying, I appreciate this. Now, let's start talking about trust. When you teach people how to be trustworthy, and I didn't know this. I mean, I've been in this business. I was in industrial psych for 9.5 years. I've been in the business of HR and working hospitals and et cetera, and college teaching for over 45 years. Got to tell you, I've never been taught how to be trustworthy. The research on trustworthy is pretty straightforward. There's 3 pieces. 1, you don't promise what you can't deliver, ever. 2nd is integrity. And that too is something you don't get time off on. It's not like I'm high integrity, except Tuesdays from 2 to 3. Or in these specific circumstances, you know, you can really count on me, but on those specific circumstances, no, you can't. That's not how it works. Integrity does not have an off switch. I told managers repeatedly, do not lie to your people. If you ever do, the question is not if you will lie to your people, the question is when. And that's your reputation. And that will determine, to a large extent, how much your people listen to you. Now, the last piece of this, and I'm going to encourage you to really tune into this, if you wish to build trust, the steps to take are pretty straightforward. It's called benevolence. It means be kind to your people. And you know what? Don't expect payback. Just be kind to them. As long as they stay within boundaries, be good to them. If they step outside boundaries, they have choices. They can step back in boundaries or they can go someplace else to work. Not optional. You do not retain people who are poor, troublesome employees. You'll pay a big price for that one. Having said that, if they're within boundaries, be an incredibly kind place to work and watch trust grow. Remember I talked about sustainable competitive advantage? The Edelman Trust Barometer is conducted every year by the Edelman marketing firm. They look at trust around the world. They survey the whole world on trust. Right now, 14% of the people in this country say you can trust top management. It's 13% worldwide. And that's not good. And you know what? People right now are looking to the world of work to give them answers. They trust the world of work better than most other areas of their life. That's a problem. But having said that, if you want to get sustainable competitive advantage, create a highly trustworthy environment. And then just, you get the people you want. You can't just say, well, people should come to work for us because we're a great place to work. Prove it. Show them it is. Get a reputation that it is, and watch what happens. For example, one of the organizations that I work with told me the other day that they had an individual just moved to Nebraska, some distance from their hospital. They called and asked if they could interview at that hospital. And of course, they were said, sure. It was a pretty desirable kind of person, hard to recruit. And they came for the interview and said, oh man, I want to go to work here. I have heard such good things about this place. Now, to get there, they had to drive right past one other hospital, and they could have gone another direction for much less distance. They're driving several minutes, close to an hour, one way, to work at this critical access hospital because of the reputation. Have you checked out your reputation? What do people out there think of your place? That becomes very important to know. That requires you to ask some people and then to listen to what they have to say, and not challenges, to just hear it. And if you're going to reduce stress, change thinking. Richard Lazarus did some amazing work. He said, you know what? The force of stress, the cause of stress, is really one category of thought. He said, when we say, I can't handle this, then things happen. CRH is released from the hypothalamus. It hits the pituitary. Pituitary releases ACTH. It gets the adrenals. The adrenals release glucocorticoids. The glucocorticoids get to your brain, and your memory stops. And you start craving high fat, high sugar, high carb foods. We call those comfort foods because the brain likes them when you're stressed. You get fat. Obesity is to a large extent caused by stress. You get a whole variety of other things. If it goes on long enough, you can't switch off the stress response. You'll just have stress out of the blue and not know why. You'll develop, most likely, depression. Pretty serious stuff. We have an epidemic of depression right now. We've had an 80% increase in anxiety over the last 3 months. That's stress. If we change thinking, then in fact, life works better. The idea is, sure, there's hard things going on in life. At times, stuff gets tough. That's a reality, just the way it is. But something that I repeatedly say in contexts like you folks are in, I quote Winston Churchill. He said, never waste a good crisis. I'm going to encourage you to do the same thing. Things are going crazy on you. Okay. So we can stress out. We can go, oh my God, it's awful. We can say it shouldn't be that way. Or we can step back and say, okay, it happens. That's where I'm at. How do I make this work best? How do I change the way I'm thinking about this situation so we can get results that, frankly, we couldn't get in other context? The next thing I'm going to encourage you to do, and boy, I would have never thought I was going to tell you this. Back when I was growing up, meditation meant the Beatles. We thought that was a little flaky. You know, stuff the guys over in India did. We didn't think that was too cool. About 8 years ago, I started reading the research on meditation. Oh my gosh, you want to meditate. If you meditate quite a lot, that tendency of the brain to migrate to ain't it awful stops. It stops. It's the only thing I know that switches that off. Get into it. There's fantastic things that come about as a consequence of meditation. And there's all different forms of meditation. The simplest one is to inhale, think nothing, exhale, think thank you. Recognize that as you do so, you will in fact have thoughts. That's going to happen. But you don't have to pay attention to them. The analogy I use is if you're driving down the road and you see road signs, you can stop and read them all, or you can just drive on by. If you have a thought pop in your head, just drive on by. Keep the focus. Inhale, think nothing. Exhale, think thank you. Do that for 5 minutes. Eventually do it a couple of times a day. Over time, you can move into higher levels of meditation. You can involve your children, your grandchildren. If you teach them loving kindness meditation technique, which is easy, they'll be happier. Wouldn't you like to have your children and grandchildren be happier? There's one way to do it. By the way, that gives you a real way to teach your people. Look up loving kindness meditation out of the Greater Good Science Center at Berkeley. The research is good. And it's amazing what it's doing. The last thing is exercise. And we're finding, fortunately for people like me, you don't have to lift weights. You can go for a walk, especially if it's outside. Now, I learned in Sioux City, you don't walk outside in cold weather or you're going to hit the ground. Now, where Terry's at in Duluth, I'm going to guess you can't walk outside a whole lot in the wintertime. But hey, find a way to go exercise somewhere. Do something that the body's moving and stress levels go down. Gives you some flavors of things to do. I'm going to tell you, not just healthcare, but almost every organization out there experiencing some degree of trauma. I saw an interview the other day with the one fellow in this country who has a company that makes PPE. He said, I'm working 7 days a week. I can't tell you how stressful it is. We're just hustling as hard as we can to expand. Other people are calling us saying, how do you do that? So maybe we can get into it. He said, and I willingly share the secrets because we can't possibly meet the demand. We're just overwhelmed. Yeah, imagine being a PPE manufacturer in the United States today. That's stressful. It's traumatic. Smart management. Going to do something about it. don't forget Churchill. When you have a crisis, that's a time you can move your organization forward. If you get caught up into, oh my God, it's awful, it shouldn't be this way, you're just making a mess of it. Put that aside. Step back and say, this can be a chance for us to do something absolutely incredible. Now we've got to figure out what that is. Dumb management, they're just going to ignore it. Hope it goes away. Now, I have in front of you my contact information. Yes, I still have a 308 phone number on my cell phone from Grand Island. After 32 years, I thought I earned it. I'm just going to keep that forever. I will be in Nebraska, and I was born in Nebraska. I lived there for 50 years. So you guys, you call me. I don't mind that at all. I welcome it. And I'm not just out hawking business. That's not the intent. I really enjoy working with people, issues, and problems. And if you got issues that are driving you a little crazy, send me a note, give me a call. Happy to chat. What questions do you have?
And people can either unmute themselves with the unmute button in the bottom left corner of your screen or type it in the chat box and I can read them out.
As you do that, let me throw one in here. Lee, this is Terry.
Okay.
I remember 25 years ago, I was the head of a hospital network, and we had a group of nurse managers, that the directors of nursing. And I remember in some of the discussions, they talked about the younger generation coming up, and they just basically weren't as reliable, weren't as resilient, et cetera, as such. It's just basically what I'm saying is that for 25 years, I've been hearing that, and we know that each generation is newer, has different values, et cetera. Our current generation, folks, Keeley's age, are kind of the newest employees that we're dealing with. And obviously that group are going to have a different approach, different values than you and I might coming out of the baby boom generation. Talk a little bit about how we manage stress in these different generations. And I think particularly the youngest that, have been brought up very differently. They've been on cell phones most of their life, et cetera.
Okay. A couple things. First of all, the first time I know that an individual was critical of the younger generation, he said, I just don't have much hope for the future. These folks are just not cut out for work, et cetera, et cetera. That was Plato. It seems that every generation we go, one or more generations before, is critical of the one at present, the new one. So I don't give it a whole lot of stock, per se. It's been a persistent problem that way, and it really isn't. It's just they're different. The boomer generation, I will tell you, in my experience, is responsible for about half the conflict. I was really surprised at that when I was at St. Francis and began to find out what was causing the fights. We were having so much conflict. And when I went digging, I found out it was intergenerational differences. In particular, the boomers have a term that was coined for our generation that was never used before. Our parents did not fit it, and they don't like it. All subsequent generations don't like it. We are the workaholics, and we're somewhat proud of it. And what I found was the boomers were saying, these young people just aren't working enough hours. When in fact, all other generations were saying, boomers, you're kind of crazy. You ought to balance your life a little bit more. One thing that I would say to the young people like Keeley to get in front of stress, actually an intriguing thing, it's called the flesh effect. The IQ of young people today, as compared to the IQ of people that were around when the Stanford Binet IQ test was first created, is 25 points higher. This is the smartest generation in the history of the world. Every generation has got a little bit smarter. So Keeley's group is smarter than ever. Where they've had challenges is in the emotional intelligence realm to a certain extent, because this is our first true digital group. We've never seen this before. Fortunately, I understand there are people out there creating video things to enhance emotional intelligence. I think it's great. But for Keeley and folks like that in her group, I would encourage learning about stress, learning how to think differently, learn to meditate, get some exercise. The things that I'm talking about here, that's not generation specific, but do it. Develop the discipline necessary to, in fact, get to a point that life just isn't so stressful. And if you find yourself overthinking something, going, oh my God, it's awful, knock it off. Go a different direction, change how you think, and say, you know what? This will work out. It always does. And worry, at the core of anxiety is worry. I ask people, what percent of things that you worry about actually happen? Research would say less than 10%. Now, of the 10%, how many of those are you just not able to handle? Well, virtually none. You're able to handle virtually everything that comes along, even if it's awful. So what is the value of worry? How does it improve things? I've yet to find anybody that says, oh, it makes it so much better. If you identify what the problem is, you pull it apart, you come up with an answer, you start the implementation, then stop thinking about it. It does no good. It serves no useful purpose. And recognize the mind can do that. You can switch off overthinking, worrying. If you don't, you pay a price. Okay?
Lee, there was a request to put up, what was that, Keely?
The reading reference slide.
Say again?
It's the reading reference slide.
Oh, sure.
Thank you.
You betcha. If you get a chance to watch Kim Cameron on a YouTube, he's the Associate Dean of the Ross School of Business. Oh, he just retired, I believe, at Ross School of Business at University of Michigan. Oh my gosh, you don't see people like this very often. He is way smart. And he said, this idea of virtuousness is creating a good work environment where you treat people with respect and dignity, and you make it a really good place to work. That's virtuousness. You know, you can trust the boss. He or she's not lying to you. They're not trying to cheat you. They're kind of watching out for you. You know, we have known for years that there's 5 drivers of profitability in a business. This isn't new stuff. How profitable is the industry? What's the capital intensity of the business? How up to date are you in terms of technology, et cetera? The 5th one is how good are you at managing people? And that's 3 times as impactful as the other 4 combined. This gets at that. I'm going to encourage you to read this a couple times.
Lee, let me jump in here because
Okay.
I would totally agree on the managing people. But what I hear over and over again from hospital administrators and hospital leaders is that basically our department managers in hospitals haven't been trained in management. They've kind of worked their way up. And I can just tell you from personal experience, management was the hardest thing I ever did. It was, you want to talk about resiliency, that helps to build it to some degree, but it also is incredibly painful in that regard. And we're now in a position where our patients are more stressed, our staff are more stressed as well. So talk a little bit about how do we kind of bring resources and training and education to our department managers, because personally, I'm really concerned about that group, and you know, we need to find a way to provide support for those folks, particularly in rural America. If you belong to a big healthcare system, maybe you have access to some of that. But if you're a typical rural hospital out there, you don't have a lot of resources available.
Well, and tragically, the way most people go about doing it is they bring in somebody to do a presentation, and whoever comes can come. The ones who can't come, maybe they're able to record it, and they might pay some attention to the recording. But at the end of the week, about 90% of everything they've heard is forgotten. So that is a problem. The flexibility is not there for most training operations, et cetera. And that's what I did for years. And frankly, I just thought, you know what, we got to come up with a different approach. And we have put everything online in the work that I do with people. I'm training them how to be effective managers. In particular, what I train is how to be an effective people manager. I don't teach finance. much better people than me to do that sort of stuff. But, you know, when you start talking about how do we do this, train individuals at a time that they can do it, in a location that they can do it. And thank God for computers, you can just load it on the computer and call it up when it's convenient for you, and then come together and talk about what you've learned. Research shows that if you follow up that face-to-face training or online training with some other activity that involves like a coaching intervention, where you sit down and you talk about it in some fashion, there's about a 40% improvement in retention. Well, if they don't retain it, you're out of luck. So that's one. The next thing that I would suggest is, in fact, to get to a point that the training is somewhat tailored. It needs to be broad enough that you can tailor it to that organization. And that's hard to do because most folks, I mean, when I did face-to-face training, most part, that's hard to do, to sit down and just rewrite a big chunk of your training just for that organization and make it affordable. So we tend to go out and give canned talks from place to place to place. Get something that's more flexible. And then the last thing, have somebody in-house, you know, the proverbial notion of boots on the ground, have a keeper. Somebody knows that stuff, one or more people. They're your resident pros that you can go to, and you can sit down and talk to them about these issues that they need to know about management, and you get good information. So you set that system up, and then be patient, because we really start talking about management development. I would say the ultimate goal is going to be culture change. Change your organization so that it is, using Cameron Brighton Cause's terms, virtuous. It's a place where you want to work. Well, that's anywhere from 3 to 10 year effort. So be patient. Know it's going to take some time. And just keep working on it. Just keep at it. And when things go wrong, don't forget Churchill's line. Don't waste a good crisis. Learn from it. Every mistake that happened is, in many ways, think of the quality people, it's gold. There's so much to be learned when things go wrong. And the last thing, I don't know how many this was on the list, I wouldn't worry a lot. Yeah, easy for me to say, I know. But worry predominantly comes from an error in our thinking. We think when something happens, it's going to bother us more than it actually does when it does happen. And we think it's going to bother us for a longer period of time than it does when it does happen. It's not as bad when it really does happen as we think it's going to be, and it isn't as awful long-term in terms of duration as it is. Now, I'll tell you, the guy who did that research is the fellow who does a commercial on television. He's got a goatee, and they talk about how much money do you have for retirement? That's him. He's the guy. He's a Harvard professor, he's a psychologist doing the work on this. Kind of cool.
Yeah.
Next question.
You know, we believe at the center that leadership and management support is so important that we are in the process of developing tools specifically for department managers, for leaders, et cetera. For example, we put together a series of podcasts that are currently available, and I would basically refer you to center.org, ruralcenter.org, which is our website, ruralcenter.org. And there are, you know, a whole series of podcasts that we are putting together. We also have materials and video resources for helping to train boards of directors. And increasingly, we are identifying where resources are, particularly virtual resources in that regard. So again, kind of stay tuned. Our board leadership training materials are coming out. I believe it's August 10th. The podcasts are already coming out kind of in sequence. So we'd refer you to the ones that are there. And I'm sure Keely would be happy to send you linkages that maybe Nancy Joe at the Nebraska Office of Rural Health could also send out if she hasn't done that already. But Lee, I understand because I've been giving you some feedback on them, that you also have resources that you're developing right now in terms of video productions, et cetera. Could you talk a little bit more about that, about why you did it and kind of what they are?
Well, the way I usually work with an organization after I got past St. Francis is it was mostly critical access hospitals in Nebraska that contacted me. And I wouldn't take a contract if it wasn't 3 years. Because if we're going for a culture change, really to make a difference, it has to be that much time. And for 3 years, I would work with that hospital, which meant I could do maybe 2 at a time. And that was about it. So my ability to reach out to other people was pretty limited, and I continued to get requests for more. And I thought, there needs to be a different vehicle. And when I first looked into creating video online training, the price I was quoted was about $400,000. I have found a way to do it much less expensive, and it works. And we have 11 topics that we have put together, and they're broken into 20, 25-minute chunks so that you don't have to sit and watch for, I think each topic is about 80, 85 minutes. But they're broken into chunks. There's multitudes of discussion questions, exercises, there's quizzes. It's about as good as I could come up with in terms of educational technique. And the beauty of it is you can go back and check it. I'm actually working with a priest, and he had a situation that was distressing. And after he got done talking with it, he said, I think I'm going to go back and watch the grudge busting video again, the whole series, all 4 of them. And he did. And then he called me and said, I'm writing a sermon about forgiveness. And he said, you know what? Yeah, we get it biblically that we're supposed to forgive, but we've never taught people how to do it before. I can do that now. So that's more or less what we have.
Yeah, and I have seen several of these videos. They're excellent. So
Thank you.
And I know that Lee's not in it to make a ton of money. He's kind of like I am in the regard that we're in the back end of our careers and doing everything we can to help, particularly in this pandemic situation. We don't have a whole lot of time left. Could you put up that your contact information again, Lee? And I want to let you know that we have a 4th webinar supported by the Nebraska Office of Rural Health, which is scheduled for 10 a.m. on August the 11th. And this is really looking at post-acute care, long-term care. I don't know about what it is in Nebraska right now, but Minnesota has been devastated by COVID deaths in our long-term care settings. 80% of the deaths, last time I checked, were in either hospital or in nursing homes or in assisted living facilities. So we're going to take a look at how do we integrate long-term care more effectively into primary care, and a variety of, Louise Bride, who's from the Stroudwater Group, is going to be our speaker. And I'm really looking forward to that. So I want to thank Lee. That was a terrific presentation. I really appreciate it. I do encourage you, give Lee a call. He will get you connected with resources, or at the very minimum books. He knows he's read more books than any single individual I've ever met. I'll just tell you that, and virtually all on this topic. So with that, Keely, any final words from you?
Nope, I think we're good to go. Thanks, Terry. And
Yeah,
thank you
so much, everyone, for being here. And I also encourage you, look to the National Rural Health Resource Center, check the resources we have available, or give us a call. We're more than happy to talk with you. Again, thanks to the Nebraska Office of Rural Health. Take care, everyone.
Bye.
Bye-bye.